an organisation which has got its ultimate roots more than 900 years ago has only survived because it adapts. St John has been very good at adapting to changing circumstances. Our scope for expansion is now really very obvious and very clear. We are in an expansionist era for St John globally, and as you say, there's never been a greater opportunity to do that.
I think everybody knows about their St John in their own country. So here in the United Kingdom, I think everybody knows St John Ambulance and the good work they do. And if you're in New Zealand, you know about the ambulance service being run by St John. In South Africa, you know about the St John service there. But what people don't know is that if you're in South Africa, you belong to this group of a family of St John, all networked together, 40 different countries with over 400,000 members, all doing work at the community level, helping their fellow men and women in the health sector for the sake of humanity. So I think the global network links up this community right across the world for the good of society and the good of the world.
The Mother and Child programme, which we've called Mama Namwana, is a programme which we've developed with 5 St John associations in Africa, and it's a really exciting programme which aims to reduce preventable death for mothers and early and newborn babies, basically. Yeah.
So we really believe that the volunteers are the essence of St John. We really believe that it's the volunteers who can change communities, who are working in the communities and can really change lives one by one. So there are more than 400,000 volunteers around the world with St John, local people serving local communities. So St John's volunteers are really perfectly placed to really strengthen communities on real issues such as maternal health in Africa, disaster preparedness in the Caribbean, working through peer education with young people across Europe, and a lot of first aid training in Asia. So we really see volunteers coming together, strengthening communities, and it's really because we're all linked by values. We're linking through local communities, and it really is all about people changing lives.
We recognised some while ago that people in South Africa in disadvantaged areas would very rarely see the inside of a hospital. So they needed caring in the homes. And that's effectively the work that we do. And we've done that, firstly, all over South Africa. And we're also involved with the integrated management of childhood illnesses, which is a United Nations UNICEF initiative. And so we do caring of mothers and children who are born in disadvantaged areas. And that's been a fantastic success because one of the highest mortality rates was in a community called Nyanga, which is only 10 miles out of Cape Town, in fact. And since we started working on that project about 12 years ago, it's been a dramatic success. And in fact, we've had a visit from Dr. Vincent Dorinda, who's the head of UNICEF, and he was absolutely amazed at the work that we've been doing. We've also been working in the rest of Africa in about 12 of our St John associations, doing home-based care and helping the associations build capacity. That's the most important thing, because if you want to do charitable work, if you want to help people, you've got to be financially sustainable. And so that's been the model for the associations from South Africa, was to learn how to be financially sustainable and how to work with ISO 9001, which is really a quality management system. And that's what we actually do. We also have 14 eye clinics across the country in South Africa where we administer eye care, and we have the St John Eye Hospital in Johannesburg and Baragwanath, Soweto, and we refer our patients there for operations when it's necessary.